Welcome to the February issue of Diseases of the Colon and Rectum. In this month's issue, we have a lot of content above and beyond the original articles that you'll find interesting. Our legislative update this month is entitled What Every Colorectal Surgeon Should Know About the ASCRS Physician Compensation Survey. And it introduces readers to a very important survey initiative that our society is conducting and needs your help with in order to better help you. Please read this carefully. In this month's issue, you'll also find a committee report on the impact of the ASCRS Research Foundation grants on the academic colorectal surgeon's career trajectory. Very interesting reading, and I hope it will also make you give more to the Research Foundation. Our Residence Corner this month focuses on the diagnosis and management of peristomal hernia. It's written by Drs. Akorji and Caston, and the expert commentary is by Dr. Martindale. And this is also associated with the availability of getting CME credit if you wish. The Journal Club in January was focused on colorectal cancer, and in February the topic is going to be pilonidal disease. And if you go onto our website at dcrjournal.com and scroll down the left-hand side of the page, you'll find our Journal Club. And coincidentally, this month, our first editor pick is also going to be on pilonidal disease. It's the clinical practice guidelines for the management of pilonidal disease by Dr. Johnson and his colleagues from the ASCRS CPG committee. Our second editor pick is entitled Magnetic Resonance Texture Analysis in Identifying Complete Pathological Response to Neoadjuvant Treatment in Locally Advanced Rectal Cancer. And this is by Dr. Acker and colleagues from the UK. And in this study, texture analysis is a new modality that assesses heterogeneity in medical images using statistical analysis. And the authors hypothesized that texture analysis of MRI images could predict a complete pathologic response in rectal cancer patients. And they basically looked at 114 patients with rectal cancer who had undergone long course chemoradiation and examined their MRIs. And they proposed that texture analysis of MRI is a new modality that might help us identify complete response. Our third editor pick is entitled A Randomized Clinical Trial Comparing Laparoscopic versus Ultrasound-Guided Transversus Abdominis Plane Block in Minimally Invasive Colorectal Surgery. And this is by Drs. Zagian and colleagues from Cedars-Sinai in Los Angeles. And in this study, the authors wanted to compare laparoscopic versus ultrasound-guided versus no TAP block in minimally invasive colorectal surgery. And they had a 2:2:1 randomization. And their main outcome was morphine usage in the first 24 hours after surgery. They found that laparoscopic TAP block was superior to both ultrasound-guided and no TAP block. Our fourth editor pick is entitled Partial Stapled Hemorrhoidopexy versus Circumferential Stapled Hemorrhoidopexy for Grade 3 to 4 Prolapsing Hemorrhoids, a randomized non-inferiority trial. And this is by Drs. Lin and colleagues from Guangzhou, China. And in this study, the authors wanted to study the long-term clinical efficacy of partial versus circumferential stapled hemorrhoidopexy. They had 150 patients in each arm, so this was a large trial with a median 5-year follow-up, so a very substantial follow-up. They found that partial stapled hemorrhoidopexy was not inferior to the circumferential stapled hemorrhoidopexy, but they found that the partial stapled hemorrhoidopexy had less postoperative pain and urgency and was also associated with better postoperative continence as well as a minimal risk of anal stenosis. Our fifth editor pick is remarkable for the fact that it has 2 accompanying editorials, one written by myself about potential industry conflict, and the other written by our editorial board member, Dr. Cosman. This paper is entitled Topical Oxymetazolisine for Fecal Incontinence in Patients with Spinal Cord Injury, a double-blind randomized controlled crossover study. It's written by Dr. Barak and his colleagues, and the study was conducted in Budapest, Hungary. And in this study, the authors wanted to investigate the effect of topical alpha agonist oxybenzolazine on fecal incontinence in spinal cord injury patients. And this was a relatively small study. Only 19 patients were studied. And the primary outcome was the number of fecal incontinence episodes in 8 and 12 hours after drug administration. And the authors found that the application of this gel had a beneficial effect with a good safety and tolerability profile. Our last editor pick is entitled A Systematic Review and Meta-Analysis of Non-Steroidal Anti-Inflammatory Drugs to Improve GI Recovery After Colorectal Surgery. And this is by Dr. Chapman and colleagues from both the University of Leeds and University of Edinburgh. And in this systematic review, the authors looked at a total of 6 randomized controlled trials involving nearly 600 patients, and they concluded that NSAIDs were not associated with adverse events, but did note that one study was temporarily suspended for safety concerns. So again, a somewhat controversial area. We have a lot of other very interesting content in our issue this month. We hope you would join us again next month. Thank you.